Hi, everyone. My internship was in the summer, and it was my role was a clinical analyst at HTC Global Services. And to go over the presentation overview, I'll be talking about the company and what my role was, and what are the clinical applications that I mainly learned and used during the internship, and what are the other tools and my experience and references. So HTC Global Services is an IT company in the healthcare, and they offer a summer internship position as a clinical resolution analyst in the Clinical Resolution Center. That's where I worked. So this was initially founded in the year 1990, and it's an independent healthcare IT services company located in Troy, Michigan. And it also provides similar services in other countries as well, in Europe, Asia, Middle East, and India. And their main goal is to make digital change happen. And the Clinical Resolution Center within the HTC, it aims to support physicians and patients to deliver timely care by understanding the critical needs. So my role was in the clinical resolution team, and as an analyst, I helped in providing first-level support to healthcare employees and patients, using clinical knowledge base within acute and post-acute environments to drive efficiencies in patient care and follow through with clinicians on the reported issues. So my role involved working directly with physicians and nurses, and the team that I was in did not give directly to the patients, but I worked with physicians of a hospital. I cannot reveal the name of the hospitals, and because of privacy reasons and company policy, but I analyzed and troubleshooted mainly two different clinical applications, Cerner and Allscripts, and whatever issues the physicians and nurses were facing with those applications. So I received issues from the clients, and I provided first-level support and documented each issue and all the troubleshooting steps. So I used the clinical knowledge base to go over and research what the issues are and how to resolve them, and answer their questions as well. And any complex issues that were sent to me, I escalated to the second level and also assisted in solving the issues. So let's talk about one of the clinical applications here, which is Cerner. There were other teams that assisted for Epic as well, but I was in the mainly the Cerner and Allscripts team. So I helped resolve issues with the power chart, Cerner power chart, and that's how this is a picture taken from Google of how a power chart looks. And here is a record. This is an example of a record of a patient. You'll be able to see all the details of the patient summary, order history, and all the results and clinical notes. And MAR is medical administration record of when they were given medicines and what time, is there any due or anything lagging, and all the diagnoses and allergies that a patient has. So for example, we received issues for ordering, where the nurses, when they ordered, they were not able to see the order placed, or they did not see it passed on to the pharmacy. So resolved issues with that. And this, the E over here is FirstNet. That's mainly used in the emergency department application, similar application, and SurgeonNet in the surgical department. And this is a FarmNet for mainly for pharmacy orders. And this is the scheduling book, where they face issues with scheduling appointments. And also with, I also assisted in the clinical administration to give credentials, login credentials to the physicians and nurses. And I worked with the health network architecture, maintenance tools, and also helped them to find out patient listings when they were not able to see, and when different hospitals in their organization were not easily integrated in it. Coming to Allscripts, Allscripts was more of a practice management support that I gave, mainly for trying to change passwords and login credentials and confirming their access. And this is an example of how an Allscripts application will look like. It has all the registration notes, the documents, and PHI. And this is a page that both the nurses and the providers see. And other tools that I mainly used in while doing the resolution or remedy and service management. So here is where in remedy, this is where I would document the issues of the clients and then how I resolved it and if I escalated it to the second level or not, and how I had resolved them. I would usually go in and remote over into the client's computer to take a look at what exactly is happening with their application and help them out resolving the issues that they're facing. And if that does not work out, and if it is beyond my scope, that's when I would send it up to the second level analyst to take a look at their account and resolve the issue that they're facing. And whenever I escalate, I would use service management to document the issue here as well, and then transfer to the second level analyst. The other tools I mainly used were Citrix Workspace. This gave me access to the client accounts, client hospital accounts, and all of the Cerner and Allscripts applications. And BombGuard is a remote software that I used to remote over into the client's computer. And Greenshot is mainly taken for to capture images from their account for the applications wherever they're facing issues. And Outlook and Teams and Pigeon was mainly the mode of communication that we used. So talking about my experience at HTC, I got a clear understanding of how the healthcare business works, healthcare IT, and two of the medical records, electronic medical record applications, and what goes into workflow, and also cybersecurity and compliance, and also HIPAA training I received. And learning with other interns, there were a group of about almost 30 interns training with me. So learning with them in person, and right after the COVID in a company in person was very much beneficial in getting to know everybody and help in understanding other concepts better. And there were many team building activities for us interns and managers. So that helped us mingle with each other and get comfortable in working. And the work environment was very friendly, and the team leads, they were always there to answer any doubts or any small issue that we had or any silly doubt that we had. So they were always there. And we received monthly feedbacks on how our work was and what was our documenting and things that we needed to improve. So that increased our efficiency in the work. And took references from the HTC Global Services website and also from Google to get the pictures of the applications as well. Thank you. So if you have any questions, I can answer.